Welcome to the Wellnest Mamas podcast. We are committed to leading a sustainable lifestyle and making community connections. In a world where stress and chaos seem to be the norm, finding balance and fostering a sense of true well-being is essential.
Whether you are just beginning your holistic wellness journey or are already deeply dedicated to the practice, this podcast is for you. Join the Wellnest Mamas as we uncover the secrets to holistic wellness and discover the power of building a healthy community that supports and uplifts one another.
Sit back, relax, and get ready to embark on a transformative journey to leading a sustainably healthy lifestyle. We're glad you're here.
Howdy, hi, everybody. It's Steph, and we are back with the Wellnest Mamas podcast.
Hey guys, I'm Caitlin, and today we're here with Heather.
Hi, Heather.
The lactologist.
Hello. Good to be here.
I'll say, so before we start, Caitlin and I came up with this awesome name the other day for a lactation tea. We're not going to tell anybody, but we're going to have to run it by you pretty soon.
We should
pretty fun.
I mean, they should get like insider tips. No, they'll take it. They'll take our idea. It's a good idea.
For the release in a couple weeks.
Yeah.
I'll let you know. So anyway, how are you?
Oh, pretty good. Yeah,
Thanks for
so
being
happy to be here. Yeah.
So tell us, how did you get into the world of lactation?
Yeah. So I originally wanted to be an ultrasound technician. And so I was going to school for that and then had my daughter, my first one. And that just put everything on pause and was a whole new world to me. Never even thought about breastfeeding before that. It wasn't just not something I never considered. But then I watched a lot of my friends having babies at the same time struggle and giving up breastfeeding, and they're so devastated, and there was no lactation support around. And so I felt like there was a need that needed to be filled. So while I didn't personally struggle until she was a toddler, almost a toddler, but a year and a half, towards weaning is when I really had my struggles. So I was very fortunate in that way. But there was definitely a need that wasn't filled in our area. And this was in Northwest Louisiana. So it was very limited.
Oh,
super
yeah.
limited.
I can only imagine. Yeah.
And so that's how I got into it. And then it just was a fast track from there. And so I did my clinicals in Louisiana. There was one IBCLC there in a huge radius. So like we went to Texas, we went into I want to say we went just a smidge into Arkansas one time. And so just a huge area of land that this one IBCLC had to cover. So, it was very busy for the one person, but there were so many people that couldn't access a lactation consultant. So I did that and moved to Washington and started my business, and now I'm here.
Wow.
Yeah.
So you went from Louisiana to Washington.
Louisiana, Washington,
And then
Texas, and then Iowa, and then Arkansas.
Wow.
So those are kind of like transition places. Texas and Iowa were, but my business before was Washington.
Interesting.
So, yeah.
Very cool.
So tell me about the difference in the culture surrounding breastfeeding, lactation, West Coast versus the South.
There is a difference.
Yeah.
There's totally a difference. So you're right about that. In Washington, it's so much more common for moms to like just know that they want to breastfeed and so passionate about it. And there's a lot more. There's more midwives, there's more doulas, there's more birth centers, there's just so much more support there. And then here, I feel like Northwest Arkansas itself, we're in that little bubble it is kind of similar, but if you go out of that, then it's much more like Northwest Louisiana, more rural areas where breastfeeding is not as common, mostly because they're lacking support, professional support. So yeah, there is a culture difference.
That's really interesting. That's kind of, I can relate to that a lot because I didn't have a lot of breastfeeding support, and I stopped breastfeeding pretty early on. And because I didn't really have the knowledge base to like know that like once you like introduce a bottle or something like that, it's going to be, there's challenges. You have to pump as often as you're, away. Like I didn't really quite understand, like that I was going to, set myself up for failure, essentially. You know,
Yeah.
it's not like you can just do it when you want and when it's convenient,
Right.
you know.
Yes. That's how it seems.
Yeah.
It's not.
But with my second child, I knew I really wanted to breastfeed and I wanted to do it longer, and like I kind of understood like how important it was, and I actually had the support then.
Okay.
And I was so much more successful.
Yeah.
And so that's
what was the difference in getting the support? Like, were you in a
well,
different
I was a
area?
young mother with my first. I was a teen mom, you know, and there was no. My mom said she breastfed, but maybe for like 4 or 5 days. Like I don't really think that you know, she really didn't have and even aunts and uncles. There was no family that really.
Same.
Yeah, even my grandma was like, just give them corn syrup. That's what I gave my kids. They were fine. I was like,
I think that family culture is
all
yeah,
had
and but I was so stubborn, at least the second time, because I know that once I dried up with my first, I was so sad that I lost that, like, I couldn't get it back. I couldn't get that connection, and he was already in daycare, and he was already, you know, going, and like, and it was just like, I knew I lost something that was really special, and so that's why I was like, I'm going to find this, and that's where the second time around I found a breastfeeding support group.
Okay.
And
those are
I had
great.
chills thinking about it, because those friends that I made at that breastfeeding support group were like godsends, you know, just having the camaraderie of, this is hard, you know, and like being able to like bounce ideas, or, you know, like if you're having struggles or issues, is this normal? It was just so nice to have that. And that's why I was in Louisiana, more South Louisiana. But that's why whenever we moved here to Northwest Arkansas, and like we started the community room, and I was like, we really need more group gathering. It's so helpful.
Yeah. I know, and it's so exciting that we have that support group going now, just so moms can come together and find out what's normal. And even if they're not having a struggle, just to be able to meet other moms who are breastfeeding, because you never know when you might hit a struggle and someone else has already gone through that, or maybe someone else is going through that, and you can feel like their mentor and helping them. So such a wonderful thing.
So tell us more about the meetings, so that if the listeners don't know, when are they?
Yes, so the breastfeeding meetups are the first Saturday of every month at 1 p.m. at the Wellnest shop in Rogers.
Directly after the birth meetup.
So it's all things birth and breastfeeding and the whole.
You can come to both. You could come to one. Come whatever you.
And it's
like.
very casual. So show up in the middle. Show up at the beginning. Show up at the end.
And bring your kids.
And bring your kids. They're welcome.
Friendly.
Kids are
It's about
welcome.
kids. Yes.
It's all about kids.
Yeah,
so
for sure.
I have breastfed now for 12 years straight. I've had 3 days off. No, it's not a trophy. I'm not saying that to anybody. Do not listen to me.
It's such
Speaking
a
of
labor
normal,
of love.
typical, that is not typical. But as a new mother, I felt like I had support. However, if I didn't, and I was seeking services from you, how do you approach new clients? Like, you, like, just kind of, what's going on? Is there an issue? Or you know?
So my visits typically look like this. I'll just kind of walk through it just a little. So so they're all home visits. So unless somebody was really uncomfortable with a home visit for whatever reason, that happens a few times, then I do have an office space I can use. But home visits, I come in, we meet, we greet, we chat, just kind of get to know each other. And then I do get the mom's health history, just a very comprehensive thing. I'm looking for like yellow flags so we can address those, red flags, of course, things that might be indicative of breastfeeding problems at any point, whether that's milk supply, latch, like anything at all, mental health, the whole holistic view.
We love that.
Yeah. Oh, yeah. I mean, it all needs to be addressed, and it really can impact breastfeeding pretty significantly. And then I do the same thing for the baby. So definitely want to know about the birth, want to know about the pregnancy, the whole picture, how they've been acting, you know, how the mom perceives, like, what do you think's going on, right? Because moms, you know your baby's better than anybody.
Getting into that intuitive space in motherhood, I feel like that's been missing for a long time.
Oh, yes. So definitely seeing their point of view, like, what do you think's going on? I'm looking at the baby's body, you know, where do they have tension, if any, you know, that can impact breastfeeding, if their little neck's kinked or their hips or anything. Doing a whole assessment of their mouth. So making sure the tongue is functioning properly, making sure the lip is working as well, essentially checking for ties, because, you know, that's tongue and lip tie that we're looking at, not just how it looks, but how it works. And then seeing an actual breastfeed. So my approach typically is show me what you've been doing, and then I'll give you any tips if there's anything that I could see could be tweaked. So I'm a little more hands-off initially, unless someone's like, hey, I really want it hands-on. Or I'm like, okay, I see what's going on. Can we do this instead? Maybe we can try holding the baby this way, or, you know, just doing any kind of troubleshooting.
I like that philosophy.
Yeah.
I do. Because I don't like the put the baby on.
Yeah.
I want moms to not
broke,
need
don't
me.
fix it.
Right.
Like,
Right.
if,
Right.
You know,
Right.
there's a lot to be said about that, and I feel like more moms, listen up, guys. More moms should be encouraged just to seek you out before there's a problem.
Definitely, preventive
Absolutely.
care
Like,
is
preventive
amazing.
Yeah. It's so important.
Yes. Yeah.
My little plug.
I feel like it's home visits with a lactation consultant are different than the hospital, because in the hospital they are much more put the baby on. You know, let me show you what to do. Yes.
And you're like,
Similar to public school. If you are someone who had a baby when 10 other babies were born that day, boom,
Yes.
boom, 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 we don't have that much time together.
That's right.
We don't have that full spectrum.
Yeah.
They can read your chart. They can see what's going on from that side.
Yeah,
But-
exactly.
and then if you're in your own environment, you can
And
really
it's different
assess.
there too.
Yeah.
You can use your chair, you can use your pillows, whatever your setup is. And just, you know, not doing it for them, I feel like is huge, because I want the moms to not need me long term. That's the main goal. Is like,
Love
can
that.
we hit this problem in a visit, 2 visits, and just kind of remain in contact and see if we need each other.
It's really empowering in that fragile state.
Oh, yeah, I
because
think
it's
so,
easy
because-
to tell people what you're doing wrong, but
Yeah.
it's not
Right.
really easy to say, like, you're doing this right.
Yeah, yeah, you're right. So after looking at the whole picture, we kind of see what's going on, what we can improve, and I make a whole care plan. We do that together. We talk about it. And then after the visits, we stay in touch. And so I'll text the moms or I'll call the moms. You know, usually text is, that's what people want, not call, especially with a baby. Like,
Right.
don't ever want to call and wake, exactly, don't want to wake any babies. So we remain in contact, and that kind of lets me know when and if we need another visit. So I don't automatic schedule like, hey, we're going to see each other again at this time, unless it's like pretty obvious, like, hey, I do need to see this again. Usually we keep in contact and see if another visit's needed. So yeah.
Love it.
So do you ever do like weighted feeds or
Oh,
anything
definitely.
like that?
Yes. So even if I don't do a weighted feed, I want to always check the baby's weight. But I mean, 98% of my visits have weighted feeds. But if it's like super early, if I see a baby in the first few days, the engorgement hasn't happened, the baby's not going to be transferring very much. Sometimes it's a little disappointing to see, 3 milliliters when it's perfectly
That's
normal.
great. Yes, yes, because their bellies are only
They're so
big.
tiny.
Yeah.
Plus the scales are like plus or minus 2 milliliters or grams. So it could just be disappointing.
Right.
Because it could show 0. Could show negative. You know?
So tell me, what's your impression of using the pump early on?
It's needed sometimes, especially because I am seeing people that are already having problems rather than the preventive visits that I would love. It's one of those things that if you don't need it, you really don't need to use it, you know, unless you want to, right? If you're wanting to do that, some people are more comfortable with pumping and bottle feeding than directly breastfeeding. You know, there's certain situations where that's appropriate. I try to just lay off of it. Enjoy your baby. Enjoy breastfeeding your baby. Don't do more. It's more work to pump, more time. And
Not
then-
necessary to fill a freezer.
No.
And totally
Yeah.
not necessary
Unless
to
it's
store milk.
necessary. I get under,
Right.
you know,
going to work or,
yeah.
right. Exactly. So if it's not needed, no
And
need.
even then, you don't need freezers full of
Right. No.
stores.
Yeah. If
I
you're going
got
back to
through
work, you
it.
need a
Yeah.
day and that's it.
Yeah, I always only had enough for as long as I'd be gone, and then whatever I pumped while I was gone was there for the next time. Like
That's
it was
exactly
so,
right.
and I felt like I was like, gosh, I'm never getting these stashes, you know. And I
Yeah.
was like, I don't understand. But luckily I had a really good caregiver that was very cognizant that this was a breastfed baby and not to just,
Overfeed.
overfeed to comfort, But yeah, I managed to work part-time and breastfeed and not have a freezer full.
Yeah.
So that worked out.
We should just normalize not having a freezer full.
Yeah, I think so.
Yeah, definitely. Yeah, as far as pumping and bottles and pacifiers, like, I'm totally not anti-bottle pacifier. They're very necessary things, whether that's preference because maybe the mom and dad want to have a date night or they just want to do an occasional bottle or overnight or whatever. My encouragement is just not do it too early. Wait a few weeks till things smooth out and, there's no latching problems, no milk supply problems, and totally fine to use bottle or pacifier. I should have brought my example bottles though. If you are going to do some pumping in bottles, you want to make sure that you're doing a good shape and a good flow. So you want those gradual slope nipples. So like a Lancino bottle is a good one. Pigeon is another bottle because it's like got this gradual slope. What you don't want is like there's this and then a nipple, right? Kind of like an Advent bottle or and then something that flows really slow.
Appropriate flow for
because most moms aren't just spraying milk very forcefully, at least not forever. Sometimes in the beginning it might happen, but not forever. And so if a baby's taking a really fast bottle, then they'll come to mom and they're like,
this is not
for this.
Yes. Yeah.
What about a nipple shield? Is that something that you've ever?
I have definitely used those. It kind of comes in ups and downs where it's like now everybody needs a nipple shield and now nobody needs a nipple shield. For the most part, I don't use them because we can usually work through problems without a nipple shield. Very few cases I've had them where it was a long-term nipple shield use.
Okay.
Usually it's like maximum 2 weeks and then we're weaned off the nipple shield. It can cause supply problems. The baby can get used to it. That's kind of like number one problem. So yeah, they could be necessary.
Yeah.
Certain medical conditions for the baby. Very seldom would it be like incompatibility with nipple and baby.
Right.
I very rarely see that. Okay. Yeah. So usually you can avoid them.
Not a first line of defense.
Definitely not the first.
As we see on social media.
Yes. Don't get
groups or whatever.
Yes. Don't just get one. Don't put it on your registry.
Right. It's
you don't need one.
Yeah.
I was a victim of social media nipple shield recommendation.
Really?
And my child did not appreciate it. She bit down so hard immediately when she would never took a bottle. Oh, okay. I shouldn't say she. I'm not throwing anybody under the bus. She's not going to listen to this podcast anyway. But yeah, she was not confused that was not me.
She was like,
no. I was under there and it hurt. So don't just willy-nilly listen to the mom groups.
Yeah, for
find
sure.
someone that knows what they're doing.
Yeah, I think that's the main thing is if you're having a problem, reach out for help. Call a lactation consultant and come right to your home and cozy up, and you don't have to go anywhere.
Nice. Right.
We'll
That's
fix
so nice.
it.
Especially during that time.
Yeah.
The baby
Oh,
and
yeah.
in the car. And
I
they
did
hate the car
newborn
seat.
photos with my last one, and I was like, why did I do this? I'm leaving the house to go and take pictures. I was like, that was silly. You should just stay home. Let everybody come to you. Yeah.
For sure. That's the best part.
So true, yes. So we talked about the community meetups a little bit.
Yes.
How else are you involved in the community, or how do you integrate into the community? Tell us about
so the meetup, amazing, which we've only had 2 now so far, so we're still
But they're
growing.
scheduled out through the whole year, which is
Yep.
great.
They're all set up. I like meeting different providers to figure out who kind of build a team of. I do refer out to people, right? So like chiropractors or craniosacral, or obviously dentists. I'm referring out if that's necessary. Massage people, just getting a whole network of who's in the community, who's like the best at what they do, who in different areas, because I see people, moms all over, so I need to know where to send them based on where they live. So just meeting people, that's really the main thing, is meeting people and then doing the meetups. And then kind of, I'll look on like Crunchy Moms group, of course, because there's so many breastfeeding questions on there. So I'll just pipe in every now and then. I'm like, hey.
That's nice.
Not even advertising my services unless it's like clearly
Just
needed, but I'm
helpful.
like, here's some little advice.
Are you part of the functional medicine group of NWA?
Is it a Facebook
I'll get
thing?
you connected. It's on GroupMe, but
Oh,
I should get
okay.
you connected in there because it's lots of chiropractors. And
Oh,
I mean,
sure.
You could hit it from both angles, helping mom, helping babies.
Functional
and
Yeah.
aspect.
not just that.
Oh,
but so
yeah.
that would be really good.
No, that'd be
good
great.
place to connect you with. So.
Yes, for sure. Always looking to meet
Yeah.
providers in the area and anybody just in the birthy world.
Yeah.
Like we just all need to know each other
Yes.
and see what we can have to offer
Yes.
everybody.
It's so fun too when we all get we're part of it.
Yeah.
We
Yeah.
get
Oh,
together.
for
like
sure.
everybody just
We're
lights
in the
up and it's,
I know.
there's
Isn't it?
something
It's just
really
a different.
fulfilling
It's
about it.
so special. Like the birthy world is just so wonderful,
Yes.
full of wonderful people who care so much. Like everybody's hearts
It's
are
like
so
we're
big.
like actually making change.
Yeah.
Like, providing the support, getting people out there, and now people are actually like in tune. Like, well, what's going on? Oh, there's something. This is exciting. This is great. And just knowing where people can find those resources is so helpful.
Oh yeah, definitely.
So do you do any other meetups outside of just the monthly meetup?
No,
Okay,
just
that's
that.
really great.
Yeah, when we first moved here, which it's been maybe 3 years now, I was getting my master's. So I hadn't even transferred my Washington business to here
Okay.
yet. I was like on a hiatus. I'm like, I better finish this. There were no plans of a baby. I got pregnant during the master's program. Like, oh no, I was just about to open my business. Anyway, I delayed that a little bit
Yeah.
and then opened it up. So I think I really only started it here in Arkansas a year ago.
Okay.
Yeah, maybe a year and a half-ish. So it's still pretty new for the area. So I'm still learning a lot. I had like Washington on lockdown and then you move and you got to learn it
Yeah.
all over
Yeah.
again. But it's been so wonderful. There's actually a lot more resources here than I thought in terms of, especially doulas. Like we've got so many doulas, so everybody has support.
Yes.
A few midwives, like not a ton.
But there's
Several.
Not
plenty-
Washington
They're just
level,
so
but-
busy.
Not Washington,
Yeah,
right,
yeah,
exactly.
we need
Yes.
more. We need
Yeah.
more. If you're looking to go
think
into a
so.
profession, I think that'd be a good one.
Yeah, oh, definitely, definitely. Yeah, no, that's a great thing. There's lactation people here too. Like so this place is it's an awesome place to
Yeah.
be. If you haven't been, you should come.
We love Northwest Arkansas.
Yeah, it's wonderful. So just meeting people, meeting the providers. I love the birth worker meetup too, just so everybody can come meet each other, not just clients, but
Yes.
like meet other birth workers. Yeah.
So how often are you seeing tongue ties being involved in problem things? Is
Yeah.
that like kind of the go-to? Like if you're having issues, probably a tongue tie. 'Cause
Definitely
I feel
not.
like, yeah, okay,
For
good,
a
all
long
right.
time,
Yeah, that felt
kinda
like it was like,
everybody was just,
Yeah.
yep, we're getting clipped, we're getting lasered, we're getting clipped,
I
get
think
lasered.
there's different, at least in my experience, there's different providers do things differently, right? And see things a little differently. So I think there are some lactation consultants who are a little quicker to jump to tongue tie than others. I'm definitely not in the jump to it immediately. I'm like, let's see. I'll tell you. I'll tell you, I'm like, this really is a tongue tie that needs to be fixed while we're working on other things, like in the body or function or any other things. But for the most part, I am seeing 1 to 2 visits without even, I'm not even going to mention, hey, let's go get this done. I'll tell you what I'm seeing. I always walk, I should have said that earlier. When I'm doing the assessment in the baby's mouth, the mom's always next to me. Sometimes the dad's there too. And I'm showing them what I'm doing and what I'm looking for and what I'm seeing. That way they know, and they're not just taking my word for it.
right.
So I don't know percentage. I mean, probably less than 50% of people. Definitely less than 50% of people I'm suggesting going to get an evaluation even.
Okay.
And then some of the people who get an evaluation, they're like, we
be.
could probably do without it. And I'm like, okay, that's, and then it's their choice.
Right.
I'm like, this is, you just decide what you would like to do. Here's some challenges you can expect to face. And sometimes it gets better and sometimes it doesn't, right? The frenulum will never stretch, but they learn how to use their tongues differently, right? They compensate. So sometimes it just isn't necessary.
Yeah.
Yeah.
That's fascinating.
Yeah. I'm a little conservative in my approach to tongue ties.
Yeah.
So Yeah.
Which I think is good. I mean,
Oh yeah.
you know,
I don't want a baby going through that if they don't have to.
Right, right.
So it can be scary, right, for both mom and baby. Yeah.
that's really interesting. So your philosophy, can you tell us more? Like, so I like home visits. I like that you're really, you know, kind of hands off, like watch and see, not just jump to lasering and all of
Yeah.
that. Can you kind of give us like a broad description of like your philosophy and how you treat patients?
Yeah. Yeah. So mostly with that holistic approach, I'm looking at the mom and the baby, how they're interacting. Like they're kind of like a spiritual well-being in a way,
okay.
and their connection, and just like, how can we make them feel good together? So kind of focusing on that. And then I really like, I provide different options for, I say treatment, but it's not like I'm treating them, right? But in the plan, levels of crunchiness, right? In a way, it's like, how do you feel about this? And how do you feel about this and this? These are different options, and letting the mom pick what she wants to do.
yeah.
So I lean more crunchy of like natural options, right? So let's do some herbs, let's do non-pharmaceutical things first, and usually that gets the trick done. But some people are not as comfortable with it. So I would say typically my business is more crunchy, right? And then there's some people who aren't as comfortable with that, and so I just adjust accordingly. Like, that's no problem at all. Yeah.
One of my favorite little phrases is bio-individual approach.
Yeah,
Sounds like
exactly.
exactly what
Yes,
you
that's
have.
exactly
So
what it is.
it's really
Tailoring
the
it to their-
individuals.
It is very tailored to the individual.
I really like that you said you really focus on the dyad,
yeah.
like how they're, you know, the comfort level and everything. That makes so much sense. It's like if you're uneasy, you know, it's like how can you know?
Sometimes you just, you know, if you're really going through breastfeeding struggles, sometimes it feels like you can't connect with your baby, you know, like you're just, it feels off, right? Like this is not how I envisioned it. It's not how it looks in pictures
because
or movies.
it's portrayed as this like so natural, so you just
tender,
you'll get it, you know.
And it's not always that way.
No.
And so like let's fix this too, right? Like not just the physical breastfeeding problem that's going on, but let's like address how you're feeling with your baby, the connectedness. So I feel like in terms of lactation, it is definitely a lactation business, and I'm focused on that, but it's so much more than that. Like it really is more than just lactation. It's a lot of counseling.
Yeah.
So probably like 75 to 80% counseling,
Yeah.
you know, and the other is lactation. So
Because it's scary, you know, especially if like you know, in my instance where I don't have that family, there's no mommy, auntie, grandma, oh, honey, you know, like, and I feel like I'm not the only one in that boat. I feel like there's a lot of people that didn't get that, you know, just familial input.
for sure.
Like we probably would have been designed to have, you know.
That's one of the most important
Or
factors.
seeing
The seeing it is the most important factor, aside from education, you know, prenatal education on breastfeeding, to determine breastfeeding success. Because if you're exposed to it, you're seeing it, it's normalized. But if you're not, then you're like, what do I do? Or maybe you're not thinking about it. Like me. In my instance,
you're
I'm like, I don't
oh, I
know,
didn't
do
even
I
think
breastfeed
about
or
that.
formula feed?
Yeah.
I have no clue. Yeah.
Yeah.
choices.
Once you realize how expensive formula is, you're like,
Yeah.
oh, maybe.
No thanks.
That's what they
Definitely part of it.
calculate out how much it's going to cost and then decide if
an
it's worth the effort.
then the cost savings are great, for sure. Yeah.
I also wanted to just briefly talk about second-time moms, third-time moms, fourth-time moms, and beyond, because I feel like so much of the focus for IBCLC care is on first-time moms because they don't know. But kind of to your point of mom and baby working together, every baby's a new baby. It's a whole new person. And I actually didn't see an IBCLC until my third child.
Okay. Wow.
And he was actually my best nurser out of the gate, but I was just like, you know what, let's just kind of check things out. Let's see, like, I'm in a place where I'm like doing this now. Like, and I went to Leche League meetings and breastfeeding support groups with my other kids, but the first time that I actually saw a lactation consultant was with my third. And I feel like that working together for our nursing relationship was so much better.
Wow.
Yeah.
So I think just if anybody's listening and they're like, oh, I'm an old pro, I know how to do this, like there's
you
a
can
lot
optimize it.
Yeah, there's a lot to be said about, you know, don't forget about those second time moms.
That's
third
for
time
sure.
moms.
I think the most I've seen, like most children, you know, parity is 7.
Yeah.
I think I saw
Wow.
a seventh time mom, and she actually needed help. She's like, I never had problems. 6 other kids, and I mean, we fix it, right? But it second, third, fourth, fifth, sixth, seventh time moms,
Come on.
you can definitely use a
third
little
babies,
help.
honestly.
Yeah.
We're being,
They're the turning point.
I struggled with my third the most breastfeeding initially, and he ended up needing a tongue tie.
Okay.
So we did have him snipped at like, gosh, he must have been like 4 or 5 weeks old. He was young, but not like it wasn't in the hospital or anything like that. But it was night and day. Like immediately.
Okay.
Once they revised him and I breastfed him afterward, I was like, oh, you know, like for both of us, it was just, it changed. It was miraculous.
Wow.
I was very impressed.
Yeah.
But then it caused me to like kind of think about it. I'm like, I wonder if the other ones had, you know, those issues. 'Cause
That is definitely something
number
I
2,
asked.
we definitely struggled. Like I did a lot of weird positions to kind of like make it work, and you know, and I had like a bit of an oversupply kind of thing, which probably could have been compensation, you know, like all that. And I'm like, that's really interesting how it all kind of, when you look back and you're like, well, maybe there's something more to it. And then my middle one, I ended up getting his tongue tie revised when he was 8.
Okay.
Yeah, because we were having issues with like where the palate expands, like how, you know, your tongue does so much. But I was just like thinking about it, I was like, this is really interesting. Like I did struggle, but we made it through. We did fine. Like I breastfed him for 18 months. Like it was like we survived. We made it work, but there's still that
sometimes it causes
underlying
problems later. Yeah, sometimes like sleep apnea.
Yeah.
The
Teeth
orthodontic
grinding.
thing.
He was having a lot of teeth grinding and the
sometimes food issues, even like textures.
He's
and
very picky.
Swallowing.
That one was very picky.
Speech. So it can cause issues. It's just one of those things that you can't guarantee it's going to cause issues or not, and you can't guarantee that the treatment is going to prevent any of those issues. You might still have it. It could be in your genetics. You know? So yeah.
So I don't know. It's so fascinating to me.
Oh, it
like
is.
whenever I learned about how the mouth is molded by the breast, I was like, whoa. Like, you know, like it makes so much sense as far as like
does.
it provides that skeleton of, you know,
That
flexing,
big natural
that big
expansion.
open, yes,
and that actually, and to tie that into something earlier with the bottles and pacifiers, the occasional bottle use and occasional pacifier use, totally fine. But when we're looking at palate expansion, using a bottle a lot or using a pacifier a lot, it makes their palate form to shape the pacifier bottle, which is small, right? So just using it if needed. That's the goal. Use it if needed and no more than needed.
Yeah. So good. So are there any tips that you can offer? Like, is there anything that you can just like pull out of a bucket and be like, all right, guys,
yes,
here we go. Let's hear it.
So many things. But so I have 2 things that I'm going to say.
Okay.
And one, I'll do the short one first. The short one is that I do have a whole resource page on my website, which is just thelactologist.com. You'll see a little thing that says resources. And I'm constantly adding to it, but there's lots of different links and I categorize them. So if there's anything, any information you want to know about breastfeeding, you can find it there.
We'll make sure to link it too.
Sure. The second thing is about getting help. So getting a lactation consultant, whether it's preventive or not. Choose who you're going to see wisely. So there's lots of different people in the lactation world. Different like credentials, different certifications. So there's just a ton. That's like an alphabet soup. You know, there's like CBS and CLC and CLE and so many other ones, right? CLS, lots of different ones that mean different things. an IBCLC. And so if you're having, like, let's say you want a preventive visit and there's not a lot you need help with, but you're like, let's see what's going on. That's a perfect thing for an IBCLC, can see that, but a CLC or a CBS, you know, those are, that's totally what those are for, is for education and like normal breastfeeding. And then if you're having problems, an IBCLC is the only thing that can see complex breastfeeding situations, like scope of practice kind of thing, complex.
Complex as in, can you give me some examples? For
If there's like a problem. Like literally a problem.
Any problem.
Any problem.
Okay.
So like if there's a suspected tongue tie, it's out of scope of practice for anything but an IBCLC, or milk supply problems. You know, nipple pain that's not fixed by positioning, right? So if you can optimize positioning and get it fixed, great. Like that's totally fine. But if it's not fixed by just simple positioning, then that would be IBCLC referral. So just find the right help based on your problem, right? So if you're having a problem, then you probably do need to see an IBCLC.
I feel like we need a chart. We need to make a chart.
Oh, there are charts, but we could definitely...
For scope of practice.
For sure.
Yeah.
And so funny, with the IBCLC, there's so many there's like 3 different pathways you can do to become an IBCLC. So they all start with the same foundation, which is your like college education, your lactation specific education, which is what you do like the CLC, CBS, that's what you do before becoming an IBCLC. And then when you get to your clinical portion where you're doing your actual internship, there's 3 different pathways, and I might mix some of them up, but pathway 1, I believe, is you have to have 1,000 hours, but that's for like there's a list of approved health providers. So like pediatricians, right? Or nurses, dentists, physical therapists. There's some more in there, right? But like people who are like a licensed provider already have 1,000 hours, but they don't need an internship. They actually write off their own hours. So you can be an IBCLC.
I remember looking at that. I have my nursing license and I was like,
most IBCLCs really hate that, actually.
Oh, sure.
They really want to abolish the whole pathway 1 thing, but you know, it is what it is. Because the pathway 2 and 3 have actually had an internship where they sought out a mentor and it was all supervised. The pathway 1 does not have to be supervised. They supervise their own hours and they say, yes, I did a good job, right? And then they're an IBCLC.
Okay.
They have to still sit the exam, right? So you still have to sit an exam.
Okay.
Put that out there. And then pathway 2, I think, is more for volunteer-based positions, like the Leche League. Can't remember now. And then pathway 3 is the most common one, and that's where you seek out a mentor and you do your 500 plus clinical hours and you take your exam. So all of them have to take an exam. So we take the same exam, we have the same foundation, it's just your pathway. You know, how did you do your clinical hours? So
And the mentor would be like another IBCLC?
Another IBCLC, and it used to be, they recently changed it. It used to be an IBCLC who's been recertified at least once, which we have to recertify every 5 years.
Okay.
So it has
So
to,
somebody
it
with
used to
some
had to be
history.
one with a history. And mine was like, she was just the most amazing lady. She was wonderful. She was a NICU nurse for so long. She had been an IBCLC for like so long. She'd been in it for like 30 years, like forever. But now anybody can be a mentor. Even
Really?
if you just got certified, you could be a mentor.
Wonderful.
Yeah.
So is that
So there's-
something you're
it
interested
expands.
in doing?
I've been an IBCLC for like
No, are you
6
interested
years.
in mentoring others?
I love teaching. I feel like, because I want to, while my kids are little, I prioritize being a mom. So I'm like part-time IBCLC, and I want to keep it part-time now that, you know, my little girl just turned 2. And so it's still something I want to prioritize. What I would love to do is not formally be a mentor while she's little, but like informally. So like you have to sign up and like, this is my mentor. I have to, like, I have full responsibility of my mentee where I track all the hours. We have to do a booklet of education. Like it's pretty intense. But I would love like sit over coffee or hang out at the Wellness shop.
Talk lactation.
I want
Some
to
more peer
talk
support.
lactation,
Yeah.
but- and try to
Kind of plant
help
that
guide them,
seed.
like be a mentor without the formality of being a
Got it.
mentor, if that makes
That's
sense.
amazing.
Talk
Yeah.
about complex
A support
cases.
person.
Absolutely. I like talking about all the complex stuff and just guiding them through
Yeah.
it. So yes,
Yeah.
Yes.
but not formally. And I will not be paid for it. I just want to chat.
Not in this
That's
season.
amazing.
Yeah.
Not in this season for
Yeah.
sure. It'll probably be a few years before I want to do that.
That's really wise. Yeah. Because you want to make sure that you are able to give as much
Oh,
as
yeah.
it requires. Because it
for sure.
sounds like that's an intense
On both
program.
ends.
1,000
It's teaching.
hours. That's
Yeah.
that's a lot of work.
Yeah.
Yeah.
Yeah. It is a lot of work. But
It's worth it.
it's
though.
the wonderful.
Yeah.
It's the most wonderful.
But I
job.
imagine you really do need that because you have to see
do.
so many different
Oh, yeah.
aspects. It's not like you're just gonna. Yeah, I don't know. You can't. Yeah, you can't.
It's not a
just-
simple thing. You have to see a lot of different variety of cases. And it comes in seasons. So like you see a lot of one thing and then then you don't see that for like many months.
Wow.
And then it comes back again. And it's like suddenly everybody has, PCOS. It's like, why
yeah.
does everybody have PCOS right now?
Right
It's like,
now.
right now, everybody has it. So yeah, it takes quite some time. It was like a year and a half for me for just the clinical part.
I
Okay.
feel like they call that the Queen's Gambit effect. Like it's something that's on social media or on Netflix,
and then everybody's
everybody's like,
yeah,
"I'm gonna
everybody-
play chess."
Yes.
And then the like sales of chessboards goes up, and you're like, "Oh, PCOS is the new Queen's Gambit."
That's exactly what happens for sure. Yeah. So resource page, I guess long answer for resource page, and pick your lactation provider wisely.
Love it.
That's my
Very
tidbit.
good. Very good.
It's a
Yeah.
great tip.
Yes.
That's a really great tip. And luckily, we have so many options.
Yeah.
You know?
Oh, there are definitely
Yeah.
lots of options. There's me. Arkansas Lactation has like a bajillion. I don't know, like 10. Honestly,
wow.
I'm not sure. They have a lot.
Yeah.
And they're all IBCLC.
Really?
They don't hire non-IBCLC
Okay.
for like their lactation consultant positions. So that's I
That's nice.
definitely adore
they have
that.
like a fleet.
Yeah, me too. I know. I can't quite do that level, but yeah, we have a few. I think Dolly Crespo. I met her at the last meetup, the birth worker meetup. That was amazing.
yes.
So yeah, we've got some.
Yeah.
Yeah,
That's
we
great.
have enough.
And you know where to find us. Where to find everybody.
Yes.
Oh yeah.
First Saturday of the month.
Yep. See you there. All right. Is there anything else you want to share before we wrap things up?
That's all. I was just so
Okay.
happy to be on here.
This was wonderful. Thank you
This
so
was
much, Heather.
fun. So, bye everybody.
Bye.